Hi, I'm Ron Porter, the interim CEO of the Colorado Health Foundation. I want to welcome you all here today. Um, we've got a special legislative briefing for this year's 2015 Colorado Health Report Card. It's released by the Colorado Health Foundation partnerships with Colorado Health Institute. It's, um, it's a tool that helps us to determine how Colorado is doing in relationship to health. This is the 9th year. It's been a wonderful process, and it continues to improve each year. You all have a packet. Does everybody have a packet? Okay. Included in the packet, you've got the 2015 Health Report Card, one-page overview, an overview of the community health needs and priorities identified by the local public health agencies. For legislators, we've got some folks there. Thanks for coming for that. You'll find a listing of active grants that the Colorado Health Foundation is funding in your district. That's important for us going forward. And then an overview of both the Colorado Health Foundation as well as CHI. The audio portion of this presentation is being live streamed, is available to the media afterwards, and for those people who can't join us. And with that, I'd like to introduce two of our panel members, Michelle Leek, who is the President and CEO of the Colorado Health Institute, and Don Murphy, Medical Director, Medicare Services, Colorado Access, and the Board Chair for the Colorado Health Foundation. So, before we get started, I'd love to have audience participation. So, how many people here know what the Colorado Health Foundation is and what it does? Who doesn't? It's okay to say who doesn't. Okay, cool, because a couple of years ago I didn't know either, okay? It's a foundation that works at improving the health of Colorado, and it's a wonderful place to work, and we can't do anything without our partners, and so we'll talk more about that in a little bit. Second question. I heard rumor that a lot of times people in this building don't see eye to eye on things. And there's a lot of debate once in a while. And I was wondering if just for today, for this presentation, we could change that up a little bit and see if we can come up with a foundation that all of us would agree on, which is, would it be better for all our Coloradoans to be healthier in the future than they are today? Does anybody disagree with that? Okay, so see, it doesn't always happen. We can always find some things that we can all agree to. So, let me get my clicker. So the Colorado Health Foundation, like you said, a lot of folks don't know what it is. It's a foundation that's been around for quite a while. Recently, in the last 4 years, it ended up with getting a little chunk of change. So right now, we are the largest foundation in Colorado and the third largest health foundation. Our focus is to ensure every kid in Colorado has the opportunity to eat healthy and engage in physical activity. We fund training for school food service staff to cook healthy meals. We'll work to ensure kids live in communities with safe playgrounds, sidewalks, and walking trails. And health coverage, what do you suppose that is? That would be an umbrella. Our focus is to ensure all Coloradans achieve stable, affordable, and adequate health care. Health coverage, I apologize. So this means like the in-person network assistance for all of the sign-ups that we've done through the state's insurance marketplace, and health care, which would be a heart. Our focus is to ensure all Coloradans achieve health with support from a network of primary care and community services. We fund clinics in hospitals or in schools. We partner with local recreational facilities to try to improve health and start and maintain exercise programs. We want to make sure that all patients have access to their health information electronically with the ability to talk to their doctors, get their medical records, all those types of things. So we'll be working in these areas for the next several years, and we've got some goals that we set for 2023. And you can't see that at all, but it's probably in your packet. Let me try to hit some of the things. What we plan on doing by 2023 is when our partners, the foundation, and the communities across Colorado, when we're all successful, this is what we can expect. For healthy living, we want all Colorado kids to be fit and healthy. We'll have the childhood obesity rate down to 10%. Children's fitness levels will meet appropriate standards that will be determined. In health coverage, all our Coloradans will achieve stable, affordable, and adequate health coverage. 95% of Coloradans will have health coverage. That's our goal. And underinsured Coloradans reduced to 4%. That'll be down from nearly 13% today. And health care, all Coloradans will achieve health with support from a network of primary health care and community services. We want to reduce the number of days Coloradans are kept from doing usual activities due to poor physical health to 2 days a month. So those are big goals that we, as you'll see in the report card, we have a ways to go, but we can do this because we can all do it together. That's how it all works. So partners in health. As I mentioned before, in each legislator's packet, you'll see this work looks like in your district, along with some statewide efforts. We're very intentional about doing this together. We have to do this. We're all partners. The Colorado Health Foundation, doesn't have entities of its own other than an operational group that deals with a graduate medical education program, which is helping to increase the workforce in Colorado. But in grant making, we're going to invest in work that aligns with community outcomes and helps us to achieve our vision. And our partners are private sector, government, healthcare leaders, policymakers, which is why we're here, educators, and the private sector. We also engage with grant making, public policy, investing in evaluation, private sector partnerships, and strategic communications. So that's what the Health Foundation is. We have a wonderful partner who has done wonderful work for us and done it for the state. And we're going to talk now. She's going to give us a detail of what's happening in the 2015 report card. So it's my pleasure to introduce Michelle Leek.
Afternoon. Okay, let's try that again. Good afternoon. My name is Michelle Leek, and I am the president of the Colorado Health Institute. Thanks for the introduction, Ron, and it is my privilege to share the results of the 2015 report card with all of you here today. It feels a little bit like old home week, lots of friends and colleagues in the audience, and it's my pleasure to do this today. So the 2015 Colorado Health Report Card. I began to think about all those words, and I started first with thinking about health. And what do we mean when we think of health? And so I did what anyone does who comes up with questions like this, and I said, how do other people define it? This is how the World Health Organization defines health. And what I want to underscore on this definition is it's not merely the absence of infirmity. Health is something more than just the absence of sickness. And I thought that was a really important concept to underscore when we think about the report card. The other definition is about healthy communities, and it comes from the Center of Disease Control. And what I want to underscore here is that a healthy community is one that creates, it goes on to say, it helps people develop to their fullest potential. And what I thought was so interesting about these definitions is that 9 years ago, the Colorado Health Foundation had this idea of developing a report card. And the report card measures both the health of individuals as well as the health of the community. CHI has been lucky enough to be a partner for that period of time, which means that we scurry back to the office and we do all the data crunching to make sure that what we're sharing with you is accurate. But I wanted to just say that health is a really important concept, and I acknowledge the Health Foundation for trying to measure our progress around health over the course of nearly a decade. So then I began to think about what a report card is. And the report card in this case is, we've seen this a number of different times, 9 to be exact. You'll see a new format this year. We got rid of it used to look like a medical record, an old medical record, and then we realized that nobody knew what an old medical record looked like anymore, and so we changed the format of that. And so this report card, I also wanted to share with you that I'm the mother of 2 high schoolers, and so there's a little excitement in our house about getting the report cards. Semesters are more excited than other ones. But the report card does 2 things for kids in high school. One of them, it gives a snapshot in time, right? So this is how you did the first semester of this year, right? But then when you don't have a great grade in trigonometry, what do you say to your parents? You say, Mom, colleges look for improvement. That's what they said. So at least that's what my son told me, is that we need to look for improvement over time. We just don't look at the actual grade. And I begrudgingly heard that argument. And so the report card, we are doing two things with it this year. We're looking at the snapshot in time, but for the first time, we're looking at how we're doing. Are we becoming better students? Are we getting better? Are we getting healthier? What does that trend over time look like? So the report card will be familiar. The format is different, but the methodology is the same. We look at 38 indicators. We spread those across the life stages, so babies, kids, teens, adults, and seniors. And we pull and cull data from a variety of different sources. These sources are the American Community Survey, what we fondly refer to in the health policy terms as the BRFIS, which stands for Behavioral Risk Factor Surveillance System. Did I get that right, Natalie? Healthy Kids Colorado, which used to be the Youth Risk Behavioral Survey, and the National Survey of Children's Health. So that's the methodology behind the report card, and now I'm going to dive right into the results. Before doing so, the photos that you see in the report card itself, as well as the photos that you see projected up here on the screen, they should be the same. Let me know if they're not. That would be a problem. Were taken by CHI's very own Brian Clark. He's in the back actually taking photos of you right now. And he's gone out to grantee sites of the Health Foundation and looked at sort of health in action, what we're doing on the ground throughout the state. This comes from a nutritional program run by the pediatrics department at the University of Colorado. It's teaching families, vulnerable families, how to cook and more nutritionally, soundly, or something. So here are the grades, what you've all been waiting for, the big drum roll. And I wanted to share with you a few things about this. I hope that you see this as you see this through a frame of optimism and not a frame of discouragement. And I will share a little bit what I mean by that. You can see that we do best with healthy adults and healthy aging. So we're getting a B+ and an A- in those categories. Where we see what's stubbornly low, what refuses to sort of move year to year, are the healthy beginnings, our babies and our kids. And we're going to explore in some detail about that. There are three takeaways I'd like you to have from the results this year. As Ron mentioned, we are making slow and steady progress. It takes decades to move these metrics. We are working and we're in directionally the right direction. Where we have the greatest room for improvement is in our kids' health. And thirdly, and I think most importantly, when you look one level down, when you begin to peel back this report card, when you begin to look at the indicators and what's driving our poor ratings, or our average ratings, I should say, particularly in babies and kids, it's really a story of disparities and it's a story of inequity. And we'll explore that in the next few minutes. We chose to launch the report card here in the old Supreme Court chambers at the legislature because of the way that we sort of envision and see policy. Policy is very broad, and state legislators play a very important role in much of what we do. And when we see changes and improvements on the report card, often we can go back and identify a piece of legislation that was passed and implemented within the state that really makes a difference. So here, as a reminder for legislators in the audience, here are some areas where your choices, your selections over the past decade have made a difference in the report card. So you have a lot of choice in terms of insurance coverage. Who's in, who's out of Medicaid. You have choices about the small insurance market and the individual market. We also have a lot of choices about financing, like the provider fee, and paying for that, like the Payment Assistance Act of 2012. Healthy schools, we can legislate around the food the exercise, activity levels that happen within our schools. And finally, workforce. When we have 1 million people in Medicaid, when we have hundreds of thousands more Coloradans with health insurance than we did 2 years ago, how we have a workforce that can provide care for those individuals is also important. So you're seeing bills this year around the APNs, and other kinds of what we call scopes issues around who can provide what kind of care, when, and how. So your decisions that you make are directly influence the report card over time. So thank you for being here, and thank you for making the decisions that you make and deliberating about those decisions importantly. We're going to pick 3 areas today where we think that there's a lot of ample room for deliberation and ample room for policy decisions. These are sort of policy-friendly kinds of issues. The first one is around physical activity, the second is around mental health, and the third is around insurance coverage. So I'm going to dive a little bit deeper into all of those areas. If you want a really deep dive, you can look at the report card. You can look at the last few pages are dedicated to methodology. And if you're really a data geek, and we actually know who you are because we're CHI and we watch who comes to our website, you can come to our website and you can dive down even further into the data and the details beneath this. And so before I go any further, I want you to look around the room. Look to the person to your left. Do you know him? Look to the person to the right. All right. Tell me about the health of the people in this room. What would you conclude about our health of the people in this room? What? They're all what? Breathing. They're all breathing, so are we relatively healthy? All right. I guess that's a good sign. What else can you say about the people in this room? Sleep deprived. Thank you. Okay, what else can you say about the people in this room? We look pretty healthy, don't we? We all look pretty thin. We all look like we know where our local gym is, right? We can delude ourselves when we think about how can we have a C when we all look like the people in this room. We look pretty healthy. Now I want you to close your eyes and imagine recall your last walk down the 16th Street Mall. Okay? Probably a different picture appears, right? Somebody say yes, please. Okay, so it's we have it, and so Coloradans, it's easy for us to begin to think that we all look like the people that we hang out with, and that's not the case. And so when we think about the report card overall, we need to think about all Coloradans. And here's a few tidbits about average Coloradans, or all Coloradans combined, I should say. More than 1 in 5 of us is obese adults. More than 1 in 5 kids lives below the poverty line. And we rank 37th for on-time high school graduation. So if you look at all the states, we're only 37th in terms of on-time graduation from high school. So we need to have this composite view of Coloradans, what they look like. Not only people in this room, the people on 16th Street Mall, we need to look at that average over time. The other thing is that we are changing as a state. We're changing as a state. We tried to go back to 1950 to see how we've changed. The data, how we've collected data have changed, but in 1950, 98% of us on the census reported that we were white. And so we are seeing a big change in that racial ethnic mix. And so here, today, 31% of us are minority. We project by 2040 that will be nearly half of the state of Coloradans. And so we're changing. We look different than we are in this room, and we're changing over time. And then finally, we have seniors. A lot of people have talked to you about the senior tsunami. What are we going to do with all the people in long-term that we need for long-term care and other kinds of services regarding the aging of our population? This was the first year. I've been doing the report card for 5 years. This is the first time that I calculated that in 2031 I will go from actually talking about seniors to being a senior, and that was a little depressing to me. But you get the picture. We're all aging, right? We're all getting older. There's more and more of us to take care of as we do that. So what can we do about this? Where are there leverage points? Where are there particular places in legislation and philanthropy, in the environment in which we live, where we can really make a change? So I first want to start with physical activity. This is information pulled at the sort of more granular level from the report card. What you see at the top is an indication of how we're doing with kids, teens, adults, and the very last line is seniors, okay? And what I want to call your attention to are the numbers in the bubbles over the ones and twos. And so on the indicators that we use for physical activity, they're different across the different age spans. But what we can see here is that we're doing great with adults, and we're doing pretty gosh darn well with seniors, right, in terms of them getting physical activity. Where we're not doing as well as we rank 24th in terms of school-age kids who participate in vigorous physical activity, and 13th with teenagers along a very similar kind of metric. So when we're thinking about where to invest our dollars, our resources, our time, our energy, this might point to that we might want to spend some time thinking about kids and babies. Kids and teens. Somebody pointed out to me that babies are just sort of active. They kind of move around, and there's not a really good way of measuring that, particularly on self-reported data. So here's how we're doing with kids. 1 in 10 is still obese within the state. And what I think is really interesting is this 2 out of 3 kids, only 2 out of 3 kids are getting 20 minutes 4 times a week of exercise. The recommended amount, 60 minutes 4 times a week. And so this is a really low-hanging bar when we're thinking about this, and we're not doing a great job with only 2 out of 3 kids meeting that sort of lower threshold criteria. I said that the third takeaway, does anybody remember what the third takeaway was from that slide, is that this is really a story about disparities. And when we pull back the layers of the report card and begin to look at these indicators by socioeconomic status, by poverty levels, what we find is we see this kind of cascading stair step just about in every indicator that we look at. And so the lower your income level, the poorer your health outcomes are. So this is illustrating physical activity by income. If you're over 400% of FPL, which is federal poverty level, 3 out of 4 rather than 2 out of 3 kids are making that threshold, right? In terms of mental health, I want to switch over to mental health for just a minute. This is a story of looking a little bit beneath the data. In terms of mental health, we're doing pretty well. Teens rank 9th, adults rank 12th, and seniors rank 11th. But what's happening is that as a nation, we're doing not so well in terms of mental health. And so we're relatively good compared to other states. But 1 out of 4 kids in high school reports some depression within the last year. And so this is something that we have to pay really close attention to. There are promising initiatives, I think. The Governor's Crisis Center launch, the Mental Health Parity Act, which was passed last year or the year before, are all steps and indicators that we're moving in the right direction. I mentioned the stair step again. This has to do with the people who are reporting depression by income. So the greater your income, the less likely you are to report on this depression score. So again, this is a stubborn effect of poverty and low income. Yeah. Yeah. So I don't think that we factor in the suicide rate. And so we don't, there are some limitations of the data in terms of getting it sort of the same from all the different states, but it's something that we can certainly follow up on. Yeah, because it doesn't match sort of what we experience here in the state with our very high suicide rates, particularly down in the Springs and the ski resort areas. Excellent point. So finally, I wanted to turn to insurance coverage because, again, this is a place that legislation can really impact and play a significant role. And I think that the very promising news coming out of the report card is that we did do much better in terms of kids getting insurance. So we have halved the rate. And so in 2007, 14% of kids were uninsured. That rate is now at 7% due to CHIP in 2008, due to a Medicaid expansion, and due to the recent Medicaid expansion with the Affordable Care Act. That last expansion, however, is not picked up in the data. So the news, next time I see you, is going to be even more promising because we have early indications from places like the Gallup poll that we're doing even better in terms of our uninsured rates. And so if you've been involved in this, if your kids Cover Colorado, Kids Covered, the Children's Campaign, nice work. I also wanted to turn just for a second to look at the healthy, this idea of trending over time. And you can see that we have been, these rates have been, or our grades have been stubbornly low throughout the report card. And we don't know exactly why this is, but I don't have to go too far. The Denver Post yesterday with this issue on immunizations, it's hot, it's political, it's, we're debating a lot of the issues about why the immunization rate in Colorado is so low, but that's one of the drivers of the C's that we're receiving across time in the report card. So with that, that's all the deep dives I will share with you. There are more, of course, in the report. We're also very happy to take your individual questions at CHI. And I just wanted to end by saying that while we've launched this at the legislature, and legislation plays a very important role, it takes all of us in this room to really move the needle, to drive the kind of change that we want to see and the improvements that we want to see on the report card. I looked at the list of people who were here and in attendance. We have the advocacy community, we have members of the executive branch, we have members of the legislative branch, we have providers and clinicians and hospitals and delivery systems represented. We have nonprofit organizations. It takes all of us to change the report card, and I thank you very much for your time today.
Thank you, Michelle and Ron, and thank you all for being here. My name's Don Murphy. I'm a geriatrician. I get to work with the board and the staff, helping to move some of these very stubborn needles. So, here we are, 10,000 feet. The report card gives us a view of how we're doing in general as a state. But what these data don't really reflect is the ground level, granular level activity of so many good projects around the state that really contribute to improving the health. So here we have volunteers at the Los Alamos Community Garden thanking the foundation for the support in that. Our goal really is to find enough projects, help sustain them, they build off each other, learn from each other, scale it to size, so that in any of the things we're measuring, we can see that C maybe move to a B minus, to a B, who knows, 2023, 2030, get up there to the A level in the different categories. Michelle teed off the 3 key areas, and so I'm going to reflect a little bit more on those. 1 out of 3 of our kids just don't move enough. I mean, they do not get close to the recommended 60 minutes of some kind of physical activity a day, whether you're talking 4 days a week, 7 days a week, whatever. They're just not doing that. Now, 40 years ago, many in this room, many in our state, would ride our bikes to school. We would walk to school. That's what happened, or at least 50% of us did 40 years ago. Today, it's 15%. So, despite that trend, there are a lot of excellent programs around the state where we're improving the infrastructure so that we can make walking and biking more appealing, more safe, more community-based. Consider, for example, CDOT's program, Safe Roads to School, Safe Routes to School. So the Colorado Department of Transportation has funded 705 projects Since 2005, these are in urban, suburban, rural areas throughout the state where we're encouraging more of this activity. Just a couple of examples. Look at Littleton, all right? So here we have Federal Boulevard right here. On this side, we have the neighborhoods where most of the students live. And over here, we have a couple of schools, Goddard Middle Elementary and Centennial Academy. Well, you can imagine that with the heavy traffic on Federal and the high frequency of these kids and parents aren't crazy about the kids walking or biking over here. But in fact, with one of these programs, so that the schools working with the city able to improve the sidewalks, to put in pedestrian-activated crosswalks, we have a lot more kids biking and walking to school. Another example, Gunnison Elementary. In Gunnison, they lost a young kid to an auto pedestrian accident, tragic loss, but it galvanized the community to work together to make things safer and more attractive for walking and biking to school, including things such as incorporating pedestrian and bicycling safety in the classroom, parents and students making pledges to walk to school together, getting community volunteers to act as cross guards, developing groups, walking and bicycling groups. So in Gunnison, they're seeing a lot more of this. Now, unfortunately, this excellent program, which again has supported 705 projects around the state, 95% of them, by the way, showing significant increases in walking and biking to school. Unfortunately, that's due to expire at the end of this year. But if the legislature decides to renew this, then we really have a much better chance of sustaining these good developments and further working with the other groups in the state that are working on this. Mental health. So yes, 1 in 4 of our kids report some degree of depression. I'm not going to ask you to raise your hands, but anyone in this room, tell me you have not been impacted by a young person committed suicide. You have been. We all have been. All right? So we know it's a problem. Now, although I'm a geriatrician in real life, I'm going to pretend like I'm a pediatrician. The issue is the same. It really is. So in a clinic I work with, here's my clinic. There is no way that I can sit there hoping that at the University of Colorado or whatever other professional schools are supplying the providers, there's no way I can hope for more child psychiatrists. Not going to happen. There have to be some, and I have to tap into them, but they're not going to solve the problem. It's just not going to happen. What's going to happen, and what CPAC, the Colorado Access and Psychiatric Consultation for Kids program is doing, which is partly funded by the Colorado Health Foundation, is it's helping me and all of my colleagues in this clinic, number one, develop the skills and resources to learn how to take care of the kids that are coming in to see us. They're coming in, they're getting pediatric care, family practice care in this clinic, but we're now able to get better skills, resources so that we can help these kids deal with this problem. Number two, they're helping us connect with the experts in the community, whether it's a child psychiatrist, the therapist, the community mental health centers, so that I now can have access. I can have a phone call. I'm 30 minutes away from being able to get a hold of a child psychiatrist if I have a crisis in the clinic. Or if I know that, no, what we really need here is a lot more care coordination, it's going to take a long slogging process to get the kids through the system and the help they need, I have access to that now. So it is reflecting a theme that all of us in primary care know is coming, needs to develop more, and we're really desperate for. It's about teamwork, and it's about knowing that the docs are not going to solve this. We're not, okay? We have to be working with all kinds of professionals that can get the kids the help they need. And by the way, we expect that roughly 136,000 teens, kids, will be impacted by this program by the end of this year. Coverage. This area is one where we probably can say Colorado may be the biggest success story in the country up to this point. As you saw, we've cut in half the rate so far of uninsured kids. For adults, it's gone from from 17 to 11%, big significant cut. And in parallel with that, we are seeing reductions in cost. So consider insurance premiums, all right? The market is playing out such that insurance premiums are going down in different places. Summit County is a good example, typically a very high cost place with all the folks wintering, skiing, et cetera up there. A typical monthly insurance premium went from roughly $484 down to $266 monthly premium in a year's period of time. Now I can tell you that last year I gave up skiing. I rarely did it. I'm lousy and I'm an accident waiting to happen. But it wasn't my decision that caused those numbers to drop, okay? It's not keeping me off the slope. Something is happening where indeed in a typically very high area, we're seeing reductions in those costs. Now, so what does that matter to us? Well, it matters to us because anyone in this room who has health insurance and is paying premiums, or any citizen out there who's paying into the public systems, it does impact us. It's lowering the premiums that we're taking when we can do this most cost effectively. We know that coverage leads to better health. We know that. That's not debatable. We know that it leads to reduced risk of significant debt and bankruptcy. And we know that the systems are more efficient when more people are covered. So they're going to be using the ER a little less once they know that they can rely on primary care. Consider the hospitals, for example. An average hospital in Colorado in a couple years ago paid roughly $4.6 million a year in uncompensated care. That went down in a period of a year to 2.9. So that 1.7 million that the hospital saved, yes, some of that's going to their bottom line, great, good for them, but it's also impacting what all of us are paying for health care here. Now, part of our further goal is to get, obviously, more people covered. We have a ways to go there. We're doing well. The report card shows that. But we also have as a goal to help the consumers become more engaged, more savvy, more informed, so that they're really taking on more of this role. So anyway, those three areas, a lot to do. I think it's really cool where the report card shows us where we are having a more immediate impact in the last year or two. But it's also given us that uncomfortable reality that some of these things, long haul. And yes, we do have to be optimistic that over a period of time, and one of the beauties, I think, of our strategy refresh at the Colorado Health Foundation is that we're giving ourselves time with many, many other partners around the state to try and get these things done. That wraps up our presentation portion. We're now going to have a panel discussion. And I think Ron is going to moderate, and Michelle and I, and by the way, we're going to be dragging all kinds of you folks in with our lifelines.
Yep, thanks, Michelle and Don. I'd like to remind the audience that we are live streaming this, so if you have a question, you'll get a microphone and ask your question into that. Do we have any questions? Surely there's got to be a good question. That clear? When are we going to start working policy? Yes, there's a gentleman right there.
Hey, would you mind saying your name into the mic?
James Corbett, Centaur Health. So the question I have is a lot of focus on enrollment, which is important, particularly during Medicaid expansion. What's the plan long term? Because I think we know that folks will continue to churn off and on, irrespective of how far we go with the coverage. So long-term planning around enrollment.
I can certainly start.
I'm
You're on.
mic'd. So I don't have to worry about that. I think there's actually some people here who can address that question a little bit more specifically than I can, but I do know that it's a concern. I know that the exchange and Medicaid are working very closely together to streamline that enrollment program and to address this issue of churn. Sue or Gary, do you want to add anything to that? Long-term strategy around churn?
So I'm Sue Birch with Healthcare Policy and Financing. So thank you, Michelle. Yes, our department is looking at the issue of churn.
or continuous eligibility. We certainly have been successful in advancing on kids in both Medicaid as well as CHIP and making the eligibility continuous, but we still need to work on what's going to happen with adults. There are ways that our systems work together that need to continue to mature to make sure that we have transitional Medicaid, or that people don't bounce between Medicaid and the exchange and back and forth. And those things are in discussion, they're in development, but we also have to work with legislators to look at how are we going to pay for adults to have more continuous coverage, because we know it will be very expensive to allow our adults to churn within the systems as well. So we're trying to do more of that analysis to look at the impacts of churn, and Colorado definitely wants to take a stance on reducing churn. It's just that, James, it's a complicated piece, and it is costly, so we are analyzing that impact to our state's general fund as well.
That was a really hard first question. Yeah.
Next question over here.
Yeah, Dean Goff.
Hey, good afternoon. I'm David Goff, Dean of the Colorado School of Public Health, and it's clear that access to high-quality healthcare services is critically important to our health. It's also clear that the social determinants of health outside the healthcare system may be even more important. So I'm wondering, what are the ideas that people have, or the policy approaches we could pursue that would invite healthcare systems and payers to join with local public health and state public health to try to move some of those levers outside the healthcare system to really make an impact on things like mental health, obesity, smoking, and so on.
Right. Do you want to? Go first. Dean Goff, thanks for the question. I think when I was looking at the mental health metrics in the report card, one of the things that struck me is that the local public health improvement plans, if you look across the state at each county that's put those together, that mental health is often, very frequently, one of the top three concerns. You look at the community health needs assessments that hospitals put together, and you see a very similar kind of lineup. So I think that the alignment is there, and your question speaks to sort of how do we get these different organizations to work together. I think there are promising initiatives like the state innovation model that are going to do just that. So we look forward to 4 years out of not having this sort of dichotomy between public health and care delivery.
I'll take a crack at that too. A broad view and then a specific example. 10 years ago, I don't think we were really, the researchers were, and some were talking about social inequities. But we've seen a sea change, I think, in our acceptance of the language and recognizing what's going on. I'll just share, we had one board meeting and the P word came up, poverty. Whoa, wait a minute. That didn't happen before, but it's happening more and more now that we recognize what really is behind a lot of poor health. We do. So we're talking about that a lot more. We're doing things to address it. A specific example, I think, around here would be this whole move towards housing first. So we're seeing those proponents that have good experiences from other areas of the country saying, hey, you know what? If we will take the 350 folks in our community that are struggling the most, provide housing, and yes, we have to compromise with the recovery folks, and how do we get the rehab, housing working together? How do we fund that? How do we lean on the foundations and others to do the private investments that get us doing it? How can we as a health plan? I can tell you at Colorado Access, we're exploring this too, so that maybe there's a way we take money that used to go to this, and that, but to put it more over here, knowing that it really will yield better outcomes. So those things are happening. And I'm sure many of you in this room could come up with a number of other examples too.
Another question. Over here down the front.
Hi, Phil Galowitz with Kaiser Health News. A lot more people getting covered, kids and adults, but can you translate that? How is that affecting access to care? So they have coverage. Are they finding it easier to get into a doctor, or are they using the coverage, and how is that improving health?
Do you want to go? You want me to-
This is my bias, okay? The data don't show this. But what's happening and what will continue to happen is that the healthcare teams, primary care office, whatever, even the specialists, will, as I mentioned around the mental health, we have to be relying more on folks from all kinds of disciplines. The initials behind one's name does not matter nearly as much as the willingness to work as a team and the commitment to doing this. And I don't care what kind of issue we're talking about. Mental health, preventive, all kinds of things. So we're going to be seeing that direction, more and more in that direction, so that efforts have to teach these teams how to take on greater volume. And I'm at least very confident. Now, it's easy for me to say as a geriatrician. Honestly, we're not dealing with the issues that our primary care colleagues who are taking care of a high Medicaid population are dealing with. But I still see the movement in the direction where more and more providers are going to figure out how they get compensated for doing a good job of the teamwork, thus allowing us to take on more volume. But getting from here to there is, yeah, we have some tricks.
I would add that there's some early signs that we're addressing that here in the state of Colorado. Two pieces of legislation that are moving their way through the Capitol. One is around advanced practice nurses and how much training they actually need in order to have prescriptive authority and other kinds of authority. So that's a sort of classic scopes issue. And then the other one is around telehealth and not thinking about that as a construct just for rural, but to think about it as how it can serve underserved populations that are urban, suburban, and everywhere within the state. So this is the other shoe that's going to drop once you insure all these folks. They're going to look for care, and we have to think it through network or workforce adequacy. I think that we have a leg up on that, both legislatively in terms of the work of the executive branch as well.
Another question. Well, I'll ask one. So there's 38 indicators,
Right.
a lot of indicators. Is there any correlation between those 5 or 6 that really have an impact on health?
I'll field that since I'm the data geek. Or I represent the data geeks of the Colorado Health Institute. When we look at babies and children, the data sort of change every other year. And so if you look at the change that we see this year, it's really around poverty levels. So when we think of that, I think of poverty, the stair step. If we're moving more kids into poverty, which we're actually not, we had a positive movement in that direction, which is new this year. I think that that's a critical driver of our overall health outcomes.
Any more questions? Yep.
Thanks. I'm George Lyford with Colorado Health Op, and thanks for putting on this presentation. This is great. One thing I'd like to ask is if you might be willing to talk about how you anticipate these metrics to evolve over time to kind of capture some of the exciting things that are going on in Colorado right now about not just coverage, but what happens after coverage with respect to how care is being delivered. I know Director Birch and her team are working on exciting things through the Regional Care Collaborative. The state's undertaking some really exciting work through the State Innovation Grant, the SIM grant. And so as we're moving more towards integrated care and delivery system reform, how will the report card kind of start to factor those changes into its examination of how we are attaining health in Colorado?
Let's get a data geek perspective, and then I'll do a Pollyannish one.
So this is sort of a classic issue of the report card. One of our highest levels of interest is how we're tracking over time. And so, from that perspective, we can't change the indicators all that often. So to the degree that the RICOs and some questions about getting adequate care are reflective of the RICOs, it's imperfect in terms of measuring these sort of new developments and trends over time. We often think about it's important to compare ourselves to other states, but it's also important to compare ourselves county to county and how we're doing over the time continuum. So we think about, you know, are there companion pieces or other ways of looking at this moving forward? Here's another. Oh, you have the Pollyanna
Well,
out.
yeah, I'm hopeful that a lot of this will involve sharing some secret sauce. So whether we're talking the health plans, you know, Kaiser and Colorado Access, Denver Health, Rocky, United, all of them kind of being willing to share some stuff, some innovation that we're all going to be working on. A lot of it is going to involve some compromise around regs that we all have to live with. HIPAA, for example. And geez, how do you really, you know, share the information if we're truly going to have an integrated behavioral and physical health when we have to live by these laws? So we're going to have to work in these messy worlds of compromising between regs and what's happening there, and also between the various systems, for-profit and not-for-profit, in terms of sharing some key things.
Is there another question?
Yeah. Hi, I'm Kristen Jones with Rocky Mountain PBS. I have some questions about some of the health disparities that you mentioned. So you said that there's positive movement in terms of kids getting out of the federal poverty level. What about some of those other indicators that are, you know, much worse for kids or adults living in poverty, mental health, you know, physical activity, obesity, that kind of thing? Do you see those moving in the right direction or the wrong direction?
Very gradually in the right direction. And one of the issues with sort of these public health metrics is that they take decades to move. And so we're attentive to that, but I think that the message of this report card, particularly when you look at it compared to earlier years, slow and steady progress, but slow and steady also wins the race, right?
So we're about, oh, we have one more because he's a board member. I can't do that.
Grant.
I'm Grant Jones. I'm with the Center for African American Health and honored to be a board member of the Colorado Health Foundation. Michelle, I'm wondering if you could comment on what's the comparable data collection and reporting from across states. I know Children's Campaign has that synchronized quite well.
Right.
And are you seeing that working really well now, improving? Can you comment on that?
I think I can, Grant. We use very consistent data sources because it's hard to find data sources that we can look at longitudinally and look across different states. So we look at the American Community Survey, BRFIS, the Behavioral Risks, I don't have my notes, Survey, Surveillance, Factors, in that order somehow, the Children's Health Survey. Those are ones that we can continually, and those are sort of trusted resources for us to go to. I'm not as certain if there are new or emerging data sets. You certainly hope that there can be to do these comparisons state to state.
So we're about ready to wrap up. I just wanted to close with something I think is really important. We've got the report card. It gives us the information that we need going forward, but it doesn't just change by itself. You know, it has to change with all of us working together as partners. Doesn't matter where we are, whether it's a nonprofit, for-profit, certainly from the legislative perspective, it's a huge policy, is a big deal. And as we work together, trying to find the common things we can agree on to move fast, and nothing goes fast when it comes to health. It takes a long time. But we got to create the foundation base where we really work together well and try to make these grades the A's that they really should be for the health of Colorado. So we thank you for all being here today. Thanks for your time, and if anybody has any questions, you can have plenty of places to call. So thanks very much.
Thank you.